Hello, my name is Dr. Lisa Campbell, President and CEO of Physician Practice Resources. Since 2002, we have operated as a full-service company that partners with small and large organizations to build solutions that enhance operational effectiveness, improve clinical documentation, and decrease overall compliance-related risk. In this 5-minute video, I hope to demonstrate the value of clinical documentation improvement for the physician's office. Clinical documentation affects the entire revenue cycle. If a medical note is not properly documented, it can have a domino effect that leads to inaccurate coding, which ultimately impacts the entire revenue cycle. To illustrate the value, let's take a look at an office visit. So here we have a 60-year-old patient that has had shortness of breath for the last 5 days. In fact, the last 3 months, the patient has experienced episodes of shortness of breath, especially with exertion. Patient states she is easily fatigued and doesn't have energy to do anything. Patient also complains of chest pain, but denies leg pain or fainting spells. Past medical history indicates hypertension, history of hyperlipidemia, patient has had 2 previous heart attacks, patient is a smoker, and 3 years ago, patient had a cabbage. Currently, the patient is on lisinopril, metoprolol, Lipitor, and aspirin. Vital signs noted: blood pressure 176/80, pulse was 104, respiration 18, O2 sat 90%. The patient weighs 220 pounds with a BMI of 28.2. During the exam, it was noted that the patient was alert and oriented ×3. Breathing is labored, lips have a blue color. Crackles were noted in the lungs on both sides. The abdomen is soft and non-tender, no murmurs or heart sounds. Neck veins are prominent and distended while the patient is sitting up. Lower extremities have diminished peripheral pulses with the pitting edema of +1 bilaterally, and the patient's skin is cool to touch. During the office visit, laboratory testing was performed. We have results of sodium, potassium, BUN, creatinine, and a BNP. The EKG showed sinus tach with a rate of 104. Chest X-ray demonstrates cardiomegaly with diffuse pulmonary infiltrate consistent with pulmonary edema. The final assessment was hypertension, the history of the hyperlipidemia, previous heart attacks ×2. The patient smokes 1 pack of cigarettes per day, left ventricular heart failure, and at this time the patient is being sent to the emergency room for further workup, but was told to continue their current medications until workup by a cardiologist, and the patient was educated to contact the office with any new complaints. So for this particular encounter, the claim went out with a final diagnosis of hypertension, pulmonary edema, a history of hyperlipidemia, long-term use of aspirin, cardiomegaly, and tobacco use. When this encounter was evaluated by a clinical documentation improvement specialist, what you'll notice here is that the codes actually changed. First up, I11.0 reflects hypertension heart disease. It was noted that the patient had left ventricular failure. So correct coding in this place is I11.0 and then I50.1. It was also noted that the patient has a history of hyperlipidemia. However, the patient is on Lipitor, which means the hyperlipidemia should be coded as a current condition. Long-term use of aspirin was correct. Now, as it relates to the nicotine or the tobacco use, it was noted that the patient smoked cigarettes, so correct coding is F17210. We were also missing the myocardial infarction as well as the presence of the aortocoronary bypass. So, challenges here with this particular note. Number one, in an outpatient setting, we should avoid the use of the term consistent with. Per coding guidelines, consistent with is an uncertain diagnosis. When we're coding for the physician practice, we do not use the term consistent with. Also, it was noted that the patient has a history of hyperlipidemia. If the patient is currently being treated for a condition, we want to make sure that it is documented as a current condition as opposed to a history of condition. If you have additional questions or want to learn more about our clinical documentation improvement solutions, you can reach us via the methods listed here. Thank you so much for listening and have a great day.